All right, welcome to the program Health Guide on Global Television, where we look at issues concerning the health of the citizenry and the best practices to employ to ensure you have a healthy body and a healthy system. On today's edition, we'll be focusing on the issue of kidnapped victims in the country, the traumatic experiences they go through and that of their loved ones. And we'll be looking at how best to help them get through the traumatic experiences, especially kidnapped victims and their families. And so what it means, we'll be talking to a mental health physician who will be taking us through the journey of recovery from that very traumatic experience. It's no secret that since 2019, mass adoptions have occurred in Nigeria from secondary schools to family members, and that's has led a lot of citizenry and their families to go through very traumatic experiences, causing mental health disturbances that have also led to suicidal thoughts and actions, as news has reported over the couple of months and years gone by. On today's edition of Health Guide, we'll be talking to an American-trained Nigerian mental health physician in the person of Dr. Ada Ike-Akor, who is joining us right here in the Federal Capital Territory via Zoom to help us look at how traumatic these experiences can be and the ways we can help the victims of kidnap events and their families go through these situations. Dr. Ada Ike-Akor, thank you for joining us on Health Guide.
Good morning. Thank you for having me.
All right,
Anthony.
Let's look at the issue of, first of all, when you talk about mental health, how serious should mental health issues be taken? Because right here in Nigeria, it's thought that mental health is only for those, like they say, foreigners, those overseas, the white people. But how serious is the issue of mental health in Nigeria and to a human being?
I mean, mental health is a very serious issue. You have depression being the #1 cause of disability worldwide. So you have a high burden of disease. Unfortunately, only 10% of people with mental illness ever get any form of treatment. So 90% are left with no treatment whatsoever, and they're just left to cope on their own how best they can.
All right. Let's look at the issue of mental health. Are there specifics as those who can suffer mental health issues? Can we say it's just for the adolescents, the adults? Which category of people can suffer from mental health challenges?
I mean, mental health can affect all ages. You can have mental health issues in childhood. Many of them start in childhood, especially anxiety disorders. Some of them start in childhood. Early adolescence is the big time. You know, the first year of college is another major time when you're out of the house and you're under a lot of pressure, academics and being away from home. So that's the time when a lot of mental illnesses manifest themselves. Into your 30s, your 40s, then you have very late onset schizophrenia. The psychotic disorders can happen at any age. And you have dementia, which is the memory loss and cognitive decline associated with aging. You can have depression, you know, as people get older. And so mental illness is something that affects every age group.
All right. In terms of now focusing on the kidnapped victims now, which is our major focus on today's edition, can you take us through what persons who have gone through the harrowing experience of being kidnapped, kept in the kidnappers' den for a number of days with torture and any other thing in between, what they go through, what is their state of mind?
Yeah. So you have a severe psychological distress when you're kidnapped. You know, you have a sense of shock, denial. I mean, this cannot be happening to me. Then you can have fear, you know, anxiety. You can have post-traumatic stress disorder if you have symptoms for more than a month, where you have hypervigilance, you're easily frightened, you're always on a high alert for perceived or real danger. You can have avoidance behavior where you try to avoid things that remind you of trauma. You can have nightmares and flashbacks where all of a sudden you're transported back to what happened to you when you were kidnapped. You can have problems with your mood reactivity. You can have poor sleep, poor appetite. Very severe. You can have suicidal thoughts of ending your life because you don't feel that life is worth living. So these are some of the symptoms of post-traumatic stress disorder, which is one of the common complications of being kidnapped. You can also have acute stress disorder, which has the same symptoms but lasts for less than a month.
All right.
You can have
In
memory
terms of, okay.
problems, you can have concentration problems.
All right. These effects you've mentioned, can you take us through when we're dealing with someone who is an adolescent to someone who is an adult? Do they face this? How severe does it relate to in terms of the different age and gender for persons going through this same harrowing experience?
Yes, post-traumatic stress disorder previously was classified under the DSM-5 as an anxiety disorder, where you have uh, preponderance. Most anxiety disorders, you have preponderance, of anxiety symptoms. But in DSM-5, they changed that and gave it its own classification because they felt it was significant enough to have its own classification. The thing about it is there are different things that determine the impact trauma will have on you. For instance, one of the major things is what kind of support do you have after the trauma. So that's why you want to encourage people who have gone through trauma like kidnapping to kind of have the support of family and friends, because this is a prognostic indicator. It can significantly impact the way you're able to deal with the traumatic experience. Another thing, when trauma is in childhood, it can be more severe because you don't have coping skills at that point in time. Your brain is still developing. I mean, the prefrontal cortex, which is a part of the brain, it doesn't fully develop until your late 20s. So when you're a child and you're traumatized, it can be very significant. Another thing is when trauma is multiple. So it's not just one trauma, it's one trauma after another trauma. You had a traumatic upbringing and now you're being kidnapped. So that's not just one trauma. And so the significance of the trauma becomes more impactful when there are multiple traumas. Another thing is what happens in kidnapping when you're unaware, when the trauma doesn't give you any chance to prepare. It's all of a sudden. These are some of the things that can lead to significant uh, morbidity and significant severity in terms of trauma symptoms. So these are some of the risk factors when it comes to deal with severity of trauma. But usually the younger you are, the more severe the trauma, the impact of the traumatic experience.
All right, let's try to narrow it down now. Let's move to in terms of the family members now, aside the victims now. Let's look at the family members. What form of trauma do they go through? The fact that looking at the word insomnia, where does insomnia fit in all this equation? And for the family members, how difficult or traumatic can it be for them not knowing where exactly their loved ones are and what their loved ones are going through, if they're dead or alive?
Yeah, mental illness has a lot to do with families because, the gist is when an individual in a family is going through mental health challenges, it's affecting the entire family. Okay, and it's traumatizing them as well to different degrees. And so family therapy is very important as part of the treatment of a lot of mental health disorders. You will need to support these families. You need to direct them to support groups You need to offer them counseling. If they meet the criteria for DSM-5 TR diagnosis for a mental health disorder, then you need to also treat them. Okay. And so there are different types of family therapies. There's strategic, there's structural, there's systemic, and others. So you need to apply what is the most appropriate depending on the symptoms you're finding in the different family members. Some people will feel guilty that they were not able to protect their loved ones from trauma. Some people will feel anger. There's a lot of anger when someone is kidnapped or someone who you love is going through a traumatic experience. Sometimes, family members can feel a sense of helplessness and hopelessness. And so, they too may come down with symptoms of psychiatric problems. Sleeplessness is a symptom of post-traumatic stress disorder. The average sleep you're supposed to 7 to 9 hours. A lot of people with trauma don't even get 3 hours of sleep at night. And, they are having nightmares, right? They're having some nightmares of the traumatic experience. And, these are recurrent, they're having intrusive thoughts. So instead of sleeping, they're worrying and panicking about what has happened to them. So sleep is definitely something you want to pay attention to when you're dealing with trauma.
All right, let's look at now let's move to the area of solutions now and caring for victims of kidnap. Before we go to the families, how expensive is it, and what's the action plan or the treatment plan time to be certain that someone who has gone through this kidnap experience, for them to be reintegrated back into the society and for them to get over this trauma? Is there a time frame for treatment, and what's the cost implication?
Yeah, I mean, let me break it down. There are 350 psychiatrists in Nigeria approximately for a population of over 200 million. Sorry?
So does it mean we have shortage of mental health physicians?
Now, 350 for 200 million, is it not shortage? So how are you going to get the treatment when you don't even have the professionals, right? And then where's the money? You need universal health insurance, right? Because, these things can be expensive. So, there's the affordability factor, the availability factor, the accessibility factor. I mean, how many mental health hospitals do you have, even in Abuja, which is a metropolitan city? You can count them on your fingers. So is this how you're going to deal with a population of 200 million? Or let's say several hundreds of thousands that have been kidnapped, or hundreds, tens of thousands that have been kidnapped? So there's a serious disparity. And I'm not really sure how the government plans to address that in terms of public-private partnerships. You have varying costs. You have indirect and direct costs. And, the cost will vary on the facility. You have the government facilities that are more affordable, and you have private facilities. Some range from 50,000 to 80,000 a night, right? So that's significant. It can drain you, financially. So how to, find affordable alternatives is something that is really important to look into. Because, after you've gone through a traumatic experience, you may need of rehabilitation.
Why I did ask the question of the number of mental health physicians, because we were being told several times when the Nigerian Army comes out to say 1,000 of plus Boko Haram repentant Boko Haram insurgents have been reintegrated into the society after going through, some health processes of reintegration. So the question is, that means technically we cannot ascertain for sure that those number of repentant Boko Haram insurgents were truly taken through this process of mental health, this trauma they've been through, to ensure that they've cleared off that trauma before reintegrating them to the society. For the kidnapped victims, with what you're saying, where does this leave us, having lots of people who have gone through kidnap experience and not getting the needed, medical attention?
People that have gone through trauma, many of them end up become perpetrators of trauma. They now want to traumatize other people because they have been traumatized themselves, whether in childhood or early adulthood or subsequently. I mean, you have to look at the factors that lead to someone wanting to become a member of Boko Haram. I mean, there are factors on the ground: poverty, unemployment, child abuse, lack of education, and so on. And then you have to have a plan to address each of these risk factors. They're risk factors, right? But what I'm saying to you, what I'm suggesting to you is, if you have only 350 psychiatrists for a population of 200 million, that's a problem. That's a major problem. How on earth are you going to rehabilitate people without psychiatric care? How will you even begin to assess them? So there's a serious shortage. And that's why most people with psychiatric problems, only 10%, 90% never get any form of help or treatment. And they're just allowed to just go on the streets or just cause problems everywhere because they're not even getting the support or treatment that they need. And that's what we're dealing with on a daily basis.
All right. From your experience, and because yesterday while we were talking before this interview, I noticed you had lots of patients coming to see you. How would you describe the number of visits of Nigerians coming seeking for mental health, care? How would you assess the range, and would that be a reflection of the economic hardship in the country also?
Yeah, I mean, the numbers have surged. That's what has happened from the COVID pandemic, and even after the pandemic was over, the numbers have surged. So what's happening, a lot of people who are already on the edge, who are vulnerable, are now being tipped into frank depression, frank psychosis, frank anxiety, because they were hanging in there, right? But now with the economy, which I think Tinubu is doing the best, President Tinubu is doing the best he can. And I'm told that he has a really good guy in central bank who knows what he's doing. So he's doing his best because, the COVID pandemic is what led to a lot of these problems. And so it's a global problem. Inflation is a global problem. It's not just a Nigerian problem. But what we're seeing is increasing numbers beyond capacity of people trying to access mental health treatment. And so we don't have the hands, we don't have we're doing the best we can with the small numbers of providers that we have. And, that's just what it is.
All right, let's wrap up our conversation. What will be your key takeaways for kidnapped victims and their families and friends? What are the key things they should look out for to ensure that someone is not at the edge of, going suicidal or going nuts? What should be the key things looked at for, and what should be the key things done to also manage the situation because of the lack of availability of mental health professionals?
Yeah, I think the first thing is to get the person out of that traumatic place into a safe place. Safety is number one, right? And then connect them with family, because support from family is a prognostic indicator. It will determine the outcome of the trauma. Build resilience. Nigerians are generally resilient people. We're quite resilient. We respond. We bounce back from hardship and everything. You need an assessment before 1 month and after 1 month. If you meet the criteria for post-traumatic stress, then you need therapy, trauma-focused psychotherapy, EMDR therapy, mindfulness therapy. You need different types of therapy, family therapy. Then if you need medication, you'll be assessed for suitability for medication, and you'll be put on a selective serotonin reuptake inhibitor, which is first line, or other antidepressants or anti-anxiety agents that will help you cope with the trauma. So that would be my advice. Get assessed, get treated as quickly as possible.
All right. Thank you, Dr. Ada. Always a pleasure talking to you, and thank you for all the key things. Families who have persons who have gone through kidnap experience, and a very sad commentary that we just have 350 mental health professionals in the country of 200 million people. Something the health sector, Ali Pate, who is in charge of the health sector, should be looking into. Thank you very much, and nice talking to you on Health Guide.
Thank you so much for having me. Thank you, viewers.
All right, that's how we'll call it a wrap on today's edition of the program Health Guide. Today we focused on the kidnapped victims, how to give them mental health care for them and their families. My name is Anthony Momodu. Thank you for joining me on today's episode.